Do you support Donald Trump?
Yes, and I support the medical and SNAP cuts to.
You support the Medicaid cuts and the food stamps cuts?
Yes.
Why?
There's many reasons why. One reason would be the improper use of fundings.
Okay, like what improper use of funds was happening specifically with Medicaid and food stamps?
Well, according to the Government Accountability Office, $100 billion in improper payments in the year 2023,
Wait,
and it's about that much.
you said the what? What are they called?
The Government Accountability Office.
And what's the title?
I guess you could just, if you want to look at it, research it yourself. I guess you could just look up improper payments, Medicaid, Medicare, Government Accountability Office.
No, what's the title?
The title for what?
Yeah, what's the title for saying that? And by the way, what where specifically is it saying within the bill that they're only cutting that specific funding?
Well, I'm just saying that's one of the reasons why I think it should be cut.
But like that, there's
I'm not.
no evidence in the bill that they're only specifically cutting like waste funding. They're cutting work requirements, or they're
Well, I don't
instituting
support a
work
program.
requirements.
I don't support a program that is wasting. Well, not wasting. That's
What do you mean by
improper.
wasting?
Well, I don't mean by wasting it. There is some wasting in it, but improper payments isn't just wasting. It could be underpayments that people didn't get the proper medical treatment that they might even need it, or it could have been overpayments even.
Okay, so
The thing is, $100 billion in 1 year is $300 million a day. If you had a company that is $1 trillion and they're mismanaging $300 billion a day, are you going to make changes?
yeah, so of course, if it is the case that there are improper payments, you'd want to address that, but there's nothing specifically within the context of the big beautiful bill that says it addresses any of the improper payments.
Well, you don't think changes can come from cutting it too?
Changes come from cutting. No, I don't think that you're cutting specifically any of the funding that you associate to be improper payments.
Do you think it's okay to have a program that is mismanaging three
I
hundred
would I
million
wouldn't
dollars?
get rid of the entirety of Medicare and Medicaid if we specifically say had $50 billion of improper payments each.
Not only that, it's not only because of the inefficiencies.
Would you get rid of Medicare and Medicaid because there's $50 billion in improper payments when we're talking about Medicare and Medicaid being almost like $1 trillion programs?
Well, I would definitely get rid of the programs because another reason is eighty
Yeah,
five
he would
percent of all the
totally get rid of the
healthcare.
programs. Wow, he wants to get rid of Medicaid and Medicare. That's what he's
Yeah,
advocating
because
for.
80.
Getting rid of the entirety of Medicare and Medicaid. So you think that people over the age of 65 should be cut off their Medicare?
Well, my dad before he passed, the Teamsters were covering him, but the thing is, or the companies should be able to provide with after retirement insurance too.
Okay, so you think that if they don't have a company to provide, then they're just fine.
Well, or their family can take care of them.
What if they don't have family? What if their family can't
Well,
afford?
I'm sure there was churches and anything, a lot of other things that can
Oh,
help.
maybe there's some church out there. What? I'm sorry. Do you think that no one has a lack of access to care right now?
Well, I'm sure people do have access to care. The problem is 85% of all the healthcare costs is for chronic disease, which is a major risk factor of just obesity alone. 40% of people on SNAP benefits are obese. Does that sound like a nutritional program to you?
Yes. So you
It
understand?
does.
You know that. Wait, so hold up. You can't just say that specifically people who have, all right, people who are obese. And can you give me the statistics on that? Give me a source for that. People who are obese shouldn't receive food stamps. You can't say that they don't
Well,
need nutrients. That's obviously absurd.
are people that are obese and malnourished or
What about
not?
children?
Well, they're obese too. Does it sound like a nutritional program if they're obese?
Yes.
How?
because it's about people who cannot afford it.
People, 53% of
So,
all people.
so you're saying if you are categorized as obese, then you should not receive food stamps?
53% of
Is
all
that what you're saying?
malnourished people.
Are you saying that if you are categorized as obese, you should not be able to get access to food stamps?
Correct.
Evil, evil. That's so
50%.
disgusting. How do you define obese?
How do I define obese?
Mm-hmm.
One moment here. Obese is accumulation of abnormal fat that presents health risks. Health risk,
Yeah,
Parker.
but how do you identify? No, how do you identify? At what are you saying at a certain BMI?
Yeah,
So you're saying
that's what they counted as.
so if you're saying you're over a certain BMI, which could be people who have certain levels of muscle, by the way, then you're saying that you
And how
shouldn't
do
receive food stamps.
how do a lot of bodybuilders, professional bodybuilders, cardiovascular issues?
Hold on, well, you're not
Yeah,
allowing me to. I don't know
right.
specifically like what it is, and I don't think you do either. You have to provide
Well,
me a source on
you're
that. But specifically
that is,
when it comes to this, you shouldn't say that people shouldn't receive any access to food because in this case that's actually cruel and inhumane. Okay, you saying that you don't want to provide literally food that will inevitably feed children is actually insane, regardless, right? If someone is obese, that does not mean that they should have a restricted access to food. They still need food to live. Like the idea that you have that they do not need food is ridiculous. Are there things specifically that we could do as a society to make people healthier? Yes. But you want to know what that is? That's expanding access to healthcare and health insurance, stuff that you don't want to do. That's specifically ensuring that people have access to food. Because if people don't have access to food, then it is the case that their health is going to go down. So if you're cutting health insurance and you're cutting people's food access, what you're doing is harming people's health. So stop sitting here and acting like you're the one that cares about people's health and you're trying to help people out when you're the one advocating for people's health to be harmed.
well, they're harming people's health. 85% of all healthcare, Parker, is from chronic disease payment. Now, what's a major risk factor of chronic disease? Obesity. Is it not?
Are you saying food stamps is causing obesity?
68,
I have a question.
68% of people.
Are you saying
No,
food stamps are causing obesity?
no,
Then what's your
no.
point?
The point is we shouldn't, if we shouldn't be helping people when we're not giving them a nutritional program, when it's a direct 85% cost of all healthcare is from chronic disease, which is the major risk factor is obesity, smoking.
So how do you prevent chronic disease? Preventative healthcare, correct?
Well, most of the time,
And how
you
do
know what
people
the
get
doctor
access to
recommends?
how do people get access to preventative healthcare? Health insurance?
Doctor, look, you can look it up yourself, Parker. What are they going to tell you if you're obese? They're going to
Did
tell
you
you to
hear health
exercise.
insurance, bro?
They're going to tell you to exercise and change your
How
diet, bro.
wait, I'm sorry. Do you not think that health insurance specifically is a fundamental aspect of being able to get access to help when it relates to, right, say whether or not someone is obese?
Well, the thing is we shouldn't be supporting 40% of the people on SNAP that are
So
obese either.
let me clarify, right? Because what you don't take into account is the effect of what it is the other way around, right? If I didn't have health insurance, right, I wouldn't be able to get help, right, when it comes to me eating because I'm the other way around, right? Oftentimes people think about, oh, it's only obesity specifically that can lead to health problems. Well, there are also lots of people that deal with health problems specifically, right, from not being able to eat enough, right? And I'm one of the people that specifically does not eat enough because I genuinely do not have the appetite. And that's why I specifically deal with myself on a personal level, right? And I have a really hard time eating, right, because of that. So I'm on the other end, right? And that is detrimental to my health, but no one ever talks about that. No one does. And even then, it would be disgusting for you to sit here and stigmatize me for that, right? So I don't know why you're out here stigmatizing people, right, for obesity at all. I think that's ridiculous. The same way that you shouldn't stigmatize me for being incredibly skinny because I can't eat. Right? Like that's ridiculous. Obviously that's detrimental to my health, but like I mean like you wouldn't go up on the live and do that. So why can't you visualize it in that respect and say that if you view this in this context to be wrong, that you're also going to be viewed to be wrong when referencing fat phobia?
Well, the thing is, Parker, the NIH labels it an epidemic. 3 out of 4 people are overweight or obese. How many
So
people?
so
How
again
many
again again are
people
so wait,
gain
do you
weight?
do you know that stigmatizing people, right, actually makes it worse? Did you know that?
Well, I think giving them.
Did you know stigmatizing people, right, makes it so it's harder for people to get access to help? Did you know that? And did you know that not providing people access to SNAP specifically because it is the case that people are obese would actually lead to that happening to a greater degree? Because that is actually aiding into the stigmatization of it. There's actually vast data on this that stigmatization, right, of people relating to, especially to eating habits, right, is very harmful towards them actually meaningfully, right, dealing with their eating habits.
Well,
That's the
here's the
etiology.
problem
Do you
part.
think you stigmatizing me for my eating habits would be beneficial to me? No, that would make it worse.
Well, maybe you can receive some assistance. The thing is
Not
people
stigmatization.
who.
Assistance is not stigmatization. Assistance for
Well, what
me
do you
would
mean
be
by
like me going to a
stigmatization?
nutritionist that I can get access to through my health insurance. You know, right? That specifically is assistance for me. Did you know that health insurance is so necessary? If I didn't have health insurance, I wouldn't be able to get access to a nutritionist to be able to help me. Isn't that insane,
Well,
right? No one in
I'm
this
sure you could
country,
pay out
and
of
the
pocket,
richest
but
country in the history of the world, should go without access to that. And
I just.
that branches to mental health care, that branches to every form of health care, right? Because it is the case that healthcare is a fundamental human right, and health insurance is fundamentally important in ensuring that people have adequate access to healthcare.
Well, I think the healthcare is a big problem because 85% of it of the all the healthcare is, like I said, is from chronic disease. What causes the most unalivings in America per
Okay,
year?
are you thinking?
Chronic
Do you think food
disease.
stamps lead to chronic disease? Actually, here's a real question: do you think in the introduction of Medicare and Medicaid would increase or decrease the likelihood of chronic disease?
Well, I think that the cuts to food stamps could give a decrease, and it will give a decrease to the overall cost of the healthcare
So wait,
system.
wait, wait, wait. So do you think do you think imposing Medicare and Medicaid would decrease, right, or increase?
Well, as we increased over time, the problem has increased. So I think the trend says your idea is probably wrong.
Oh, okay. Be specific with what you're referencing. Do you even know what we were referencing?
Well, in the year yeah, you're asking me if the people if it would help the problem if people were cut off Medicaid and Medicare, the chronic
Help what?
disease issue.
Oh, okay, yeah. So chronic disease would go up or down if it was the case that we got rid of Medicaid and Medicare.
It's hard to say, but the upward trend is as we increase the budget,
It would go
the
up. It would go up. And you want to know why it would go
went
up?
up.
Because people have lack of access to preventative
What
health
is the
care.
fact of it?
Because people have, okay, if people have lack of access to preventative health care, it is more likely that they're going to develop chronic disease.
And what's your source?
Preventative health care. So we can reference, I'll absolutely provide you a source, right? There is actually a bibliography in my bio you can check out in terms of healthcare as well. And we're actually going to be adding, right, a lot of these sources relating to healthcare right into it. There's a Yale study that goes over the effectiveness of Medicare for all that includes right preventative healthcare. Around 45 to 68,000 American lives lost every single year due to lack of health insurance. That's from a Yale study.